Hi guys, it's me again, Gareth Williams, specialist orthodontist. I thought I'd do a quick video today about your options for private orthodontics. So these options boil down into four main categories. The first one is fixed metal braces. Second one is fixed clear braces. The third one is aligners. And then the fourth one are lingual appliances. I thought I'd run through each of these categories quickly and give you the pros and cons of each so that you can come to an informed decision about which treatment option is most appropriate for you. So first of all, metal braces aren't just for children. There are a number of adults who choose to have metal braces, but most commonly I would say metal braces are the workhorse of children that are having treatment under the NHS. They're reliable, they're efficient, they certainly get the job done, but some people are concerned about the look of metal braces socially. Some people embrace that, however, pardon the pun, and they add colours and all sorts of individualisation to make it part of their look. That's certainly not uncommon. The second type are fixed ceramic braces, where the squares are clear, what we call the brackets, as are the wires. They are fixed to the teeth so that they are automatically working on your teeth at all times and don't require a great deal of compliance from you in having to remember to wear something. The pros of ceramic braces are that they work automatically. They don't require any compliance on your part. The fact that the brace works automatically shouldn't be overlooked. The analogy is that a liner to straighten your teeth is like a personal trainer for weight loss. It depends a lot on your compliance. Whereas a fixed brace is like gastric band surgery. You're going to get the result you want regardless. The downsides of ceramic braces are that they can stain if you have a lot of heavily staining foods, which can be cleaned away. And also you have to be slightly careful of what you eat. Things like toffees, hard crisps, sort of the posh crisp like kettle chips, chocolates that are out of the fridge, nuts, granola. You've got to be particularly careful with because it can, break the appliance. There are lots of substitutions that you can eat when you're in fixed braces. Certain types of crisps are fine. Skips, quavers, Pombears, frazzles. You can tell I've done a lot of market research in this area. Chocolates that are fine. Milky Way, Milky Bar, Kinder Bueno, Reese peanut butter cups. Those sorts of things. Chalk ices are generally okay. I realise it's not great fun for an orthodontist to have a video out detailing the best kind of chocolates and crisps to eat, but then, we live in the real world, don't we? The next category is aligners, which include, but is not limited to, Invisalign, which is certainly the best marketed aligner out there currently. And they are a series of acrylic or plastic trays anywhere ranging from about 20 to 40, which each have sequential millimetric or micromillimetric corrections in them, which you then change every week or 2 weeks to instigate those movements that you need. The advantages of aligners are that you can take them out to eat, and you can take them out for social events if you choose to. Conversely, the disadvantages of aligners are that you can take them out to eat, and you can take them out for social events if you need to. And what tends to happen over time is, and this isn't always the case of course, but in some patients, you will find that over time they wear these aligners less and less because they can, and you find that this lengthens the treatment time from what would have happened automatically very quickly in a fixed appliance. So if you're considering this treatment option, it's very much worthwhile in terms of your time and money to have a very honest conversation with yourself about whether you would be a good candidate for the compliance aspects of aligners. A note here on the marketing of orthodontics aligners. Now, Invisalign is one of the very few companies in the whole medical and dental sphere that advertises directly to the public, and they are not held to the same stringent criteria that healthcare professions are. So you might find that some of the adverts that you see for Invisalign, especially on Facebook, television, are slightly misrepresentative of the end product. So an Invisalign advert will look like this, whereas an Invisalign reality will often look like this. There are often a number of attachments that are needed on the teeth for the Invisalign to get anything near the level of purchase that a fixed appliance does. That's still not to say that they're very visible, but one of the most common complaints I'd get from patients, certainly if I'm taking over a course of treatment from another provider that has been unsuccessful for whatever reason, I was told the appliance would be invisible, and it is not invisible. So for this reason, fixed ceramic or fixed clear appliances and aligners both come into the category of low visibility appliances. Another thing to note is that while fixed appliances are very proficient at moving teeth in 3 dimensions, aligners are not to the same extent. And for that reason, to help move teeth with aligners, you do need to undergo a procedure known as IPR or slenderization for the most part. And that is where an emery board type file is ran between teeth to gain space in order for the aligner to be able to more effectively push teeth into those positions. It doesn't need injections and it is a painless procedure, but that is something that is not needed with fixed appliances. And then we come on to what we'd call an invisible appliance, which is the fixed lingual brace. Now, fixed lingual brace is attached to the insides of the teeth, and they are completely invisible and discreet unless you're engaging in a wide yawn or someone's looking at you from a very strange angle. They are significantly more expensive than any of the other treatment options, and they can approach twice the price. But then the advantage they have is they are completely invisible and discreet, and people will not know that you're wearing them. So there we go, guys. I hope that was helpful. So in summary, you've got those 4 options. You've got metal fixed, clear fixed, aligners, and lingual fixed. Bye for now, and as always, keep smiling.